Hello and welcome back to Anatomy, Physiology, and Pathology 2. Today we're going to be covering the lymphatic system and the pathologies of the lymphatic system. Pretty much for massage therapy purposes, the rest of the courses in Anatomy 2 are going to be fairly short. We don't, that's not our main focus areas, so we kind of get to move a little more quickly through those. But if you ever feel like you want more information or you need more information on these particular subjects, you can get with me and I can get you lots more information on the different systems if you want to go more in depth with your studies on that. Okay, so Introduction to Massage Therapy, Chapter 3 and Chapter 5. We're going to begin on page 125 with the lymphatic system. The lymphatic system is similar to the cardiovascular system because of its many vessels, but it is not a true circulatory system. It has branching networks of lymph vessels that transport the lymph fluid to and from different areas. The structures of the lymph system is lymph itself, which is mainly just polluted interstitial fluid. This is, if you remember back in the capillaries, the blood plasma that seeps out through the capillaries to fill the interstitial space in the cells and stuff, or the space between the cells more specifically. This is where the lymph comes from. It acquires cellular debris and foreign substances that are eliminated by the surrounding cells. The interstitial fluid is taken from all over the body into the lymph system, called, once it's taken in, it's called lymphatic fluid. Or lymph. It's also referred to more often than lymphatic fluid. It's just referred to as lymph. But either way, the terms are interchangeable. It could be lymphatic fluid or lymph. Either way, you know they're actually talking about the fluid. And it's just your polluted interstitial fluid seeped out from the capillaries and has kind of absorbed some of the debris from the breakdown of the cells and stuff. Okay, next up is lymph vessels. These carry lymph back to the heart. The interstitial fluids are first collected by the lymph capillaries, and then the lymph capillaries join into the lymph vessels, and that's actually how it transports the fluid back to the heart. Lymph from the upper right quadrant of the body exits the lymphatic system at the right lymphatic duct, which drains into the right subclavian vein. And the lymph from everywhere else in the body drains out of the lymph system into the thoracic duct and then into the left subclavian vein. So we have a picture here. This is showing some of your lymph vessels. These little nodules are lymph nodes. That's what we'll be talking about next. Lymph nodes are basically what filters the lymphatic fluid. Most of you are familiar with, especially breast cancer is one of the most popular or most talked about forms of cancer nowadays. They always talk about whether or not the lymph nodes were dissected or removed. And typically it's either the lymph nodes right here in the chest or it's the axillary lymph nodes. Whenever the lymph nodes are removed, then massage has to take a whole different precaution, because the body's not going to be able to properly drain as needed, and it results in the buildup of lymphedema, and we'll go into that later on. For now, the main thing that you need to know is the upper right quadrant of the body drains into the right lymphatic duct, which goes ultimately into the right subclavian vein. And everything else in the body drains into the thoracic duct and goes into the left subclavian vein, into the heart. The lymph nodes, we talked about those kind of briefly. Let's see, hold on a second. We may need to back up just a second. Okay, the flow of lymph through the vessel is also aided by the contraction of the diaphragm muscle during inspiration, which creates a vacuum-like suction that pulls blood and lymph upward toward the heart. If you notice, like right in here around the diaphragm area, there is a lot of lymph nodes. This is where your diaphragm would be. And most of your lymph nodes tend to congregate at joints where there's movement. And the diaphragm and these joints, when they move, it helps to kind of help to pump the lymph vessels to create or stimulate more lymph flow. Okay, it says lymph is specifically when the diaphragm contracts, the lymph is pushed through the one-way valves. Also, contraction of the diaphragm creates a vacuum in the thoracic cavity that pulls both lymph and venous blood through their respective vessels and their one-way valves. So it just kind of creates that little suction that helps move the lymph along. All right, now lymph nodes. So we're at the bottom of 126, and actually at the top of 126 gives you a diagram and shows you a pretty good portion of the lymph nodes. It's just showing the anterior portion, but it gives you an idea of where the lymph vessels are, where the lymph nodes. You have lymph nodes scattered all over your body. They're not just, in your neck when you get a sore throat, the doctor feels for lymph nodes. You have lymph nodes scattered elsewhere too. But the lymph nodes are just simply oval bean-shaped structures. They house and produce lymphocytes, and they filter the lymphatic fluid. It says thousands of lymph nodes can be found along the lymph vessels, and large concentrations are found at the cervical, the inguinal, and the axillary regions. Lymph nodes contain lots of macrophages and lymphocytes and have structural framework of reticular connective tissue that creates a meshwork for filtering the lymph. And then pathogens and toxins in the lymph are destroyed or inactivated and filtered out. And then the clean lymph flows out of the node and continues on its path towards the heart. So all your little lymph nodes are pretty important to keep pathogens and stuff out of the lymph system, keep it from actually making it all the way up to the heart. Little more on lymph, on other structures of the lymphatic system. You have the spleen, and that is shown here. It sits kind of back behind your stomach. And then you have tonsils. This picture doesn't show it, but everyone knows where their tonsils are. And this yellow organ here is the thymus gland. I guess technically it's a gland, not an organ, but this is the thymus gland. The largest of them are going to be, of course, the spleen. It's approximately the size of the heart. It produces lymphocytes that filter the blood. And it removes old, worn-out erythrocytes, or those old, worn-out red blood cells. The spleen also functions as a storage container for extra blood, releasing when it is necessary. It acts as a conference center for immune cells and blood cells, providing a meeting place and activity center for them. Macrophages destroy foreign substances and have chemical antigens on their surface that stimulate the immune response. The macrophages destroy foreign substances such as bacteria, pollen, and viruses that have antigens on their surface, and they help to activate the immune response. The thymus gland in children is located deep to the sternum, but as we age, the thymus gland shrinks, and only a small amount of tissue remains in adults. It sits superior to the heart, so it sits above the heart. This is the site where some lymphocytes mature. Then there's clusters of lymph tissue found in the tonsils and the intestines. The tonsils are the small masses of lymph tissue on either side of the soft palate at the back of the throat. Everyone's familiar with that when we get a sore throat or tonsils swell up with tonsillitis. Tonsils help prevent bacteria and other pathogens, such as pollen, from entering the throat. If pathogens and stuff make it past the tonsils, then they can get down into the intestines. If they make it to the intestines, they're subjected to the Peyer's patches, which is lymph tissue in the lining of the intestines. These lymph tissues are full of white blood cells that fight the bacteria and the viruses, and pretty much any bad substance that gets that far down the path, then the Peyer's patches go in there and kind of destroy that. Okay, so we'll move on now to, well, this is your picture from 126. We've got a couple of videos for you to go watch, and then we'll come back and we'll move on to the functions of the lymphatic system and then the pathologies of the lymphatic system. So we'll pause here, let you watch the 4 videos, and then come back. Okay, great. So now we'll move on to the functions of the lymphatic system. So the 3 main functions of the lymphatic system is transportation, immunity, and homeostasis. So first thing we'll talk about is the transportation. The lymphatic system is most commonly known for transporting bad things away from our tissues so that they can be destroyed or removed from our bodies. That's what the lymphatic system does. It gets the bad things out. Let's see, there are some beneficial substances that are produced in the body that can only get into the bloodstream for delivery to the rest of the body by the way of the lymph system. Fatty acids and vitamin A are end products of digestion found in the intestines. From there, then they have to be absorbed into the lymphatic system to then be distributed into the bloodstream and through the rest of the body. So not only does the lymphatic system take away the bad stuff, it also provides transportation for the vitamin A and the fatty acids to get into the bloodstream and to the rest of the body. Okay, immunity is our next function. The lymphatic system helps us fight bacteria and other foreign substances. Our white blood cells, or our leukocytes, which are made in the bone marrow and are divided in the lymphatic system. The fluid that is drained from the interstitial spaces by the lymphatic system carries these leukocytes, known as lymphocytes and monocytes. So if it's white blood cells in the lymph system, they're just called lymphocytes or monocytes. As fluid is transported to the heart to be added to the blood, it is filtered in the lymph nodes. We talked about that briefly, how the lymph nodes kind of go in and they help to get any of the bad stuff out, prevent it from moving on to the heart. And in that spot in the lymph nodes there, antibodies and macrophages are, excuse me, they're active and they're destroying pathogens that cause illness. Then finally, we have homeostasis as our third function. Okay, so once outside of the cells, the interstitial fluid can either diffuse back through the capillary walls into the blood, or it can be drained via the lymphatic system. This is an important homeostatic mechanism for maintaining proper blood volume and blood pressure. If our blood volume or blood pressure is low, the interstitial fluid will diffuse through the capillaries to be added to the blood. As a result, the blood volume and the blood pressure will increase. So actually, when you have a condition such as low blood pressure, that's not a cardiovascular system condition, it's actually a lymphatic system condition. That is one of your test questions. Make sure you are aware of that. Low blood pressure is a lymph system condition, not a cardiovascular system condition. Okay, so next we talk about the effects of massage. specifically the effects of massage on the lymphatic system. Massage can be especially beneficial to the lymphatic system because so many lymph vessels in the diaphragm muscle. The massage therapist can utilize the diaphragm to increase lymphatic flow by asking the client simply to take deep breaths. These deep breathing exercises we ask our clients to do helps to initiate the lymphatic system. It helps to increase the benefits of the lymphatic system. The numerous lymph vessels travel through the superficial and the deep fascia, and the mechanical pressure of massage strokes on these vessels increase that flow of lymph. Similarly, I can't say that word apparently. Okay, so the skeletal muscle contractions also are going to put pressure on the lymph vessel and help to pump the fluid along. We talked about that a little bit earlier, and about how specifically the joint movement and the passive contractions applied during a massage, also they're what actually activates that skeletal muscle pump. Okay, so now we'll move on to the pathology portion, but before we do so, pause here and do your presentation for the lymphatic system, listing the major components, the functions, and the effects of massage. And then we'll move over to page 245 in chapter 5 to continue. Okay, the first pathological condition, I guess, that we're going to discuss with the lymph system is going to be edema. Edema manifests as puffy, swollen tissue in an area where fluid is retained. Basically, it's just an area where excess fluid, it gets kind of trapped in between cells. When edema is related to immobility, inactivity, or musculoskeletal injury, massage is indicated for this. If it is related to another condition, massage is going to be contraindicated, especially until you get release from a medical doctor. So again, if it is a systemic contraindication, if there's an underlying medical condition, specifically if there's a heart condition or a kidney dysfunction that is causing swelling. Massage, of course, indicated for edema in the whenever the edema is caused by immobility or inactivity or an injury. The cause of edema is an electrolyte or protein imbalance or a mechanical obstruction. And then treatment typically includes diuretic medications. I've heard of people taking, well, I just went completely blank. Taking a water pill or Lasix, that is treatment for edema. Okay, moving on, page 246, we'll talk about fever. So a fever is just a body temperature that's elevated above normal. It manifests as, of course, showing up on the thermometer as shivering, flushing, and sweating. Contraindications. Fever is a systemic contraindication for massage therapy. It does indicate, though, that massage can help improve sleep when reflexive or very light. I would never do a massage on someone with a fever unless it is my own child or something like that, just to try to help to bring it down. As whatever is causing that fever, you risk getting it, and you also risk passing it to all of your clients too. Because usually fever is caused by a bacterial or a viral infection, so whatever viral or bacterial infection the client has, you risk getting it. So massage is a systemic contraindication. Do not massage a client with a fever. Treatments are going to vary depending on the cause. Again, in a professional setting, never massage anyone with a fever. Consider it a complete systemic contraindication. Okay, so that's it for the lymphatic system. Told you this was going to be short and sweet pretty much from here on out. So watch all your videos, rewatch them if you need to, and then turn in your assignments, complete your quiz, and we will continue on with the respiratory system.